Hi, welcome. This is Dr. Ted Arkfeldt with the Clinical Genius Program. I'm dressed pretty casual. It's Friday, and typically here at the clinic, we wear our game day attire. I'm trying to keep everything as normal as possible, even though there is no baseball games going on, girls softball or girls soccer. We want to still try to keep some kind of normalcy here. So I'm wearing my Gaylord home, ready to go, coaching sideline attire, and just waiting for warmer weather and this coronavirus to all be done. We can get back to life as usual. So yesterday I sent out, what do we do now? It was really a question for doctors of chiropractic. And I stated that you needed to create your own economic recovery and stop the revenue leaks in your office. And so we're going to go into step two, which is basically active rehabilitation. The medical necessity statement by Medicare and pretty much all insurance companies follow this is that you have to get the patient out of pain and you have to restore their functional recovery. In other words, you need to get them back to performing their normal activities of daily living. Passive care just doesn't do that. Passive care is manipulations, hot packs, muscle stim, ultrasound. The patient just comes in and they don't really have to do anything. They just lay there and the treatment is provided to them. When I was doing a lot of file reviews in Phoenix on personal injury cases, there was always one clinic that would come across my desk almost every month. And that clinic would treat personal injury patients 80 to 90 visits compared to other clinics that were on the average at about 20 to 25 visits. So what was the difference? Well, the one clinic that took longer relied only on passive therapy. And so the patients took longer to get better. And what I would always see in the notes is that the patient would get to a certain point and then they would go out and they'd try doing various yard projects or maybe go for a walk or a run or golfing. And they'd come back into the clinic and complain that they were having a flare up of symptoms. Well, there is no sports medicine protocol at the pro level or college or universities that has their athletes, when they get hurt, go through only passive care. So they don't just get muscle stim and ultrasound and massage and then, okay, after a couple of weeks, you're ready to go back out and play. They get them to return to play. And I think we need to take more of a sports medicine approach with our care plans in chiropractic. Yesterday, I said it was going to require maybe a change in way you do business, the way you operate your clinic to come out of this tough time. So let's delve into active rehabilitation. Well, the first thing that you can do in your office is it's really simple. You can do a functional movement analysis. And there's a lot of different programs out there that you can get. We happen to have the FMS bar here, very inexpensive. And then we started off using this code 97750, physical performance test. So this is separate than your normal evaluation and management codes that we talked about yesterday. This is a time-based code, so you have to at least perform the test for 8 minutes, and they're based on units. So that would be 1 unit at a time. And you do need to have a written report with that. So you can glean a lot of information from these various functional performance tests or physical performance testing. Now, to begin with, we use the functional movement screen right here by Postural Analysis Company. And this worked great. We used an iPad. It was an app. It was very inexpensive. And we were able to do functional movement squats. And look at the information this gives you. And then from here, we're able to go on and then put together a very specific care plan to address these issues. And then we have from the side view right here. So when you go through and do that, there's good reimbursements for the physical performance test. But more importantly, it sets up your baseline testing. And then you can come back and do this test 2 weeks or 4 week intervals to see what kind of progress the patient has made. The system that we use now, though, is called Kinetisense. And Kinetisense does a wide variety of movements. We really, now, thanks to Kinetisense, we have a movement laboratory in our office. So we can do functional movements. We can do balance testing, like is shown right here. We can do postural analysis. We can do range of motion of all the joints, cervical, lumbar, the shoulders, elbows, hips, you name it. We can do the range of motion. Kinetisense has allowed me to become very efficient in my examination procedures and making sure that I get all the bullets that I need to meet or exceed those documentation requirements. But more importantly, and I've talked about this for years, is that insurance companies and Medicare now, they want numbers. That is our outcome measures. That is evidence-based outcomes. And so you start off, you do your examination, then you come in and do something like this, or you use the app from Posture Screen, and you get numbers down. And then you go through and put them on a care plan, and you can come back and test them to see if you're meeting your treatment goals. Pretty nifty, pretty straightforward. The codes that you'll use predominantly is 97110. That is to increase strength, endurance, and flexibility. And I've heard a lot of excuses why doctors can't implement rehab into their office. It starts off, well, I just don't have the space, or I don't have the staff. Well, I had a 1,200 square foot office. My personal office was my personal office. It was the backup treatment room, it was the rehab room, and it was our conference room. So we used it for a multitude of things. We put rehab in the hallways, so patients were doing rehab in the hallways. Your rehab doesn't have to be expensive equipment. You can get by with just a foam roller and then resistance bands as well. And so it can be just as low tech as you want it to be. The other is I always hear, oh, I don't have the staff. Train your CAs or doctors, you do it. And I'll show you in just a little bit what 1 unit of therapeutic exercise, the dramatic income changes it can make for your office. Another piece of equipment that we use that is really super, super cool is motion guidance. Motion guidance is just laser. It's laser therapy. And there's a strap here on the arm. You can put it on the head. You can put it on the waist. You can do it on the quad. And you have the patient retrace different patterns that you put up on the wall. Very, very low tech, simple to get you going into rehab. For this one here, this is one of our main concussion treatments as well. And you can do 97112 neuromuscular reeducation. Now, I didn't put that code in here because I really want you just to use this one for right now to get going. And then you can progress on to 97112. 97112 neuromuscular reeducation is basically for patients who have some kind of balance or coordination problem with sitting or standing activities. It comes right from the code description itself. And so you have to document that, and you have to have some kind of baseline information that demonstrates that the patient has that problem. Resistance bands, you can use them for stretching. You can use them for resisted strengthening. I mean, very simple, extremely simple. Okay, let me get my face out of here. I'm going to go right up here. Now, this is our Blue Cross Blue Shield fees again for our physical medicine and rehab codes. So you'll see 97012 traction, muscle stem. But I want you to look at right here, massage therapy. A lot of offices around the country have this passive model of chiropractic manipulations and massage therapists. I have nothing against massage therapy, okay? I just think there's a more efficient and profitable way to run your office that you meet medical necessity, you get better clinical outcomes, and you give yourself a raise. So in Michigan, 97124 is going to pay you $15 per unit. That means you're going to cap out at $60 per an hour massage. Now, out of that $60, you're going to have to pay the massage therapist. You're going to have to do the linens and the oils and everything. And it's passive therapy. Insurance companies do not like passive therapy only. And here in Michigan, if you are billing out Blue Cross Blue Shield PPO and doctors, you're not doing the massage yourself, it's fraud. It's fraudulent billing. Their policy clearly states that if you're going to be doing massage, the doctor has to do it. Now, for other insurances, that's not the case. You can delegate that service out. So I want you to look. So it's $60 an hour versus therapeutic exercises. This is one unit, $29.64 for one unit. So at 2 units, which is 23 minutes, you're already at almost $60 on what you will receive from doing a full hour massage. And the patient has to do the work here, and you're going to get better outcomes. Neuromuscular reeducation, $33.73 for a 1 unit. So let's go ahead and keep moving on. Time-based codes, 8 minutes. So let's say, and you can plug in your own fees for whatever insurance company you're dealing with. So for right here in Michigan, so we know that we get $29.64, 97110. That is an 8-minute session with the patient. You can do it right in the room with them, okay? Let's say you have 10 Blue Cross Blue Shield patients per day. That's $296.40. 5 days, that's almost $1,500 extra per week. 4 weeks, now you're almost at $6,000 extra in the month. This is what's going to be staggering for you. And again, 1 8-minute code. Look at that, $71,136. This is what you're going to need to have your own economic recovery. You are going to need to make changes in your office so that you can get better outcomes. Everything's about outcomes, all right? It's not about the money. That's a byproduct. So you're going to get better clinical outcomes. You're going to get patients staying and doing things in your office instead of having to go someplace else. Okay, 71,000. To show you how easy this really is, if you have a treadmill that is just gathering dust in your house and you've got room in your office, bring the treadmill in and put patients on for 8 minutes and you could bill out 97110. That'd be $29.64. Or what you could do, you could put patients on the treadmill, warm them up for 8 minutes. Then you have them do foam rolling for 8 minutes. Then you have them do some resistance band stretches for another 8 minutes. That's going to be about 24 minutes, which would meet the 2-unit time of 23 minutes. So you would double that. So you would almost have $60 for a patient doing this therapy. That would double that on 10 Blue Cross Blue Shield patients per day. So now you're up with just doing 2 units, you're up to over 140,000. Neuromuscular reeducation would be even higher. In the next session, I'm going to discuss with you a new modality that we're using. It is called ARP Neuro, Accelerated Recovery Performance. It is a neurological therapy. We are using it for a concussion. We're using it for shoulder issues. We're using it for a lot of issues. This modality is what is keeping our doors open right now through this tough time. We have not had one patient that has canceled their appointments that are in our art program. So I'm going to go over that in detail with you in this next session. Again, contact information. Feel free to contact me. Call me, 989-448-8065, or email me at drarkfeld@arkfeldchiropractic.com. I'll talk to you soon.